Hey, stop what you're doing right now, because what I'm about to share with you could literally save your life or the life of someone you love. Most people think diabetes shows up first as thirst or fatigue or maybe blurry vision. But here's what your doctor may not have told you. For millions of Americans, the very first warning signs of diabetes appear not in your blood, not in your eyes, but in your feet. And by the time most people notice them, serious damage has already begun. I'm Dr. Will Graham, and in my years of clinical practice, I have seen far too many patients come to me with advanced diabetic complications that could have been caught and stopped much earlier if only they had known what to look for. Today, we're going to change that. A landmark study published by the American Diabetes Association found that over 50% of people with type 2 diabetes had measurable nerve damage in their feet before they were ever formally diagnosed with the disease. Let that sink in. More than half. And yet, nobody talks about it. We're going to talk about it today. And we're going to go through 9 specific warning signs in your feet that could mean diabetes is already at work in your body. And I'll tell you right now, sign number 2 on our list is something I guarantee you have never heard connected to diabetes before. It surprised even me when the research first came out. And I want you to stay with me all the way through, because it could be the most important thing you hear this year. But before we dive in, I want to ask you something personal. Leave a comment below and tell me, how old are you? And have you ever noticed any unusual changes in your feet that your doctor brushed off? I read every single comment on this channel, and your answer genuinely helps me create content that serves you better. Now, let's get into it. We're counting down from 9 to 1 with number 1 being the most critical sign of all. Starting at number 9. And this one is so easy to miss that most people chalk it up to getting older. We're talking about unusually dry, cracking skin on your feet, particularly around the heels. Now, I know what you're thinking. Dry skin? That's a diabetes warning sign. Hear me out. When blood sugar levels run chronically high, it damages the tiny sweat glands in your feet through a process called autonomic neuropathy. That's a fancy term for nerve damage to the automatic systems your body runs without you thinking about it, like sweating. Researchers at Johns Hopkins University found that disrupted sweat gland function in the feet is one of the earliest detectable signs of diabetic nerve involvement, sometimes appearing 3 to 5 years before a formal diabetes diagnosis. For those of us over 60, this is especially significant because our skin already produces less natural oil than it did in our younger years. After age 65, skin cell turnover slows by nearly 30%, meaning that when diabetic processes start attacking your sweat glands on top of that, the dryness becomes severe and fast. The skin on your heels begins to crack, sometimes deeply, and those cracks become open doors for infection. Patricia, a 71-year-old retired teacher from Baton Rouge, told me she had been treating her cracked heels with lotion for 2 years before she came to see me. When we ran her blood work, her fasting glucose was in the diabetic range. She had no idea the dry, cracking skin had been her body's way of waving a red flag for years. And here is what stayed with me about Patricia's case. She had done everything right. Every lotion, every remedy, every home treatment the internet suggested. She had been diligent, careful, responsible. The system had simply never told her what to look for. That is not her failure. That is a failure of information. If you are applying heavy moisturizer to your heels regularly, and the dryness keeps coming back, don't just buy thicker lotion. Ask your doctor for a fasting blood glucose test. The scientific references for everything I'm sharing today are linked in the description below. Number 8 is something that happens gradually, which is exactly why it's so dangerous. A change in the shape of your foot. Specifically, a condition called Charcot foot in its early stages. In the very beginning, before any dramatic deformity occurs, Charcot foot presents as one foot that feels warmer than the other and looks slightly more swollen or red even when you haven't been on your feet all day. This happens because diabetic nerve damage disrupts the signals that control blood flow regulation in your feet. The vessels dilate inappropriately, bones and joints weaken, and the architecture of the foot slowly begins to shift. Research from the University of Michigan Diabetic Foot Clinic showed that patients who caught early-stage Charcot changes and intervened had an 80% lower rate of severe deformity compared to those who dismissed the early swelling as normal aging. After age 70, the bones in your feet naturally lose density, something we call osteopenia. And that existing weakness makes the joints even more vulnerable to this diabetic process. The practical takeaway here is simple, but powerful. Every single morning, sit down and look at both of your feet side by side. If one consistently looks puffier, redder, or feels warmer to the touch than the other, even without pain, the asymmetry is a warning sign worth a phone call to your doctor. Number 7 is about color, and it's one that I find most people dismiss entirely because it seems so cosmetic. I'm talking about yellowing of the toenails combined with thickening and slow growth. Everyone assumes thick yellow toenails are just a fungal infection, and sometimes they are. But here is what the research tells us. A study published in the Journal of the American Academy of Dermatology found that people with diabetes are 3 times more likely to develop persistent nail changes, and that in many cases those nail changes preceded the diabetes diagnosis by 18 months or more. The mechanism is a combination of reduced circulation, meaning less oxygen and nutrients reaching the nail bed, and elevated glucose levels, which actually feed fungal organisms and impair your immune system's ability to fight them all simultaneously. After age 75, circulation to the extremities naturally decreases by up to 35%. So add even mild, undiagnosed diabetes on top of that, and your toenails are essentially being starved of the resources they need to grow healthy and clear. Thomas, a 68-year-old former firefighter from Phoenix, Arizona, came to me embarrassed about his toenails. He had been avoiding sandals for 2 years. His A1C, that's the 3-month blood sugar average test, came back at 7.8%, well into the diabetic range. Treating the underlying blood sugar issue helped his nail health more than any antifungal cream ever had. Thomas told me afterward that he had mentioned his nails to 2 different doctors over those 2 years. Both times it was dismissed. He walked away feeling like he was wasting their time. That quiet dismissal had cost him 2 years. He was right to ask. He just needed someone to listen. If you've been battling nail issues for more than 6 months with no improvement from standard treatments, please ask specifically for a diabetes screening. Don't just accept its fungal as the final answer. Number 6 is something that affects millions of seniors and is almost universally misattributed to arthritis, bad shoes, or just plain getting older. I'm talking about a burning, tingling, or pins and needles sensation in your feet, especially at night. This is called peripheral neuropathy, and it is one of the hallmark signs of diabetic nerve damage. The way I explain it to my patients is this. Think of your nerves like electrical wiring running through your legs and feet. High blood sugar is like slow-acting acid. It corrodes the protective coating around those wires over time. When that coating, called the myelin sheath, gets damaged, the signals start firing incorrectly. Instead of sending normal touch and pressure sensations, the nerve starts sending random distorted signals that feel like burning, buzzing, or electric tingling. The National Institute of Neurological Disorders and Stroke estimates that diabetic peripheral neuropathy affects between 60% and 70% of all people with diabetes. And because it often starts mildly and worsens gradually, most people assume it's just a normal part of aging. It is not. After 65, your nerves do regenerate more slowly than they did at 30. Nerve conduction velocity can decrease by about 10% per decade, but an accelerated burning neuropathy is not something to normalize. Pay close attention to whether the sensation is worse at night. Diabetic neuropathy characteristically flares when you're lying still because there's no movement to distract from the nerve signals. If this sounds familiar, please bring it up at your next appointment and specifically request nerve function testing. Number 5. And this one genuinely shocks people when I bring it up in the office. Hair loss on your toes and lower legs. If you look down at your feet and notice that the hair on your toes or the lower part of your legs has thinned out significantly or disappeared entirely, that can be a sign of peripheral arterial disease, reduced blood flow caused by diabetic damage to the arteries. Hair follicles require a robust blood supply to survive. When circulation is compromised, they are among the first things to go. A study from the Cleveland Clinic found that reduced or absent hair growth on the feet and lower legs had a significant correlation with peripheral arterial disease in patients who were later found to have undiagnosed type 2 diabetes. The connection is that sustained high blood sugar accelerates atherosclerosis. That's the hardening and narrowing of your arteries, like a garden hose slowly clogging with mineral buildup, at a rate roughly 2 to 4 times faster than normal aging alone. Here's a quick way to self-check. Look at your shins and the tops of your toes. If you are a man who once had noticeable hair there, and it's now gone or significantly thinner, bring it up. For women, this can be trickier to notice, but the same principle applies. Reduced circulation means reduced hair. Your feet are trying to tell you something. Number 4. And I want you to pay special attention here because this one can escalate to limb-threatening complications quickly. Slow healing cuts, blisters, or sores on your feet. In a healthy body, a small cut on your foot heals within a few days. In a body with elevated blood sugar, healing can be dramatically impaired. Here is why. Glucose in the blood at high levels directly impairs the function of white blood cells, the soldiers of your immune system. It also damages the tiny capillaries, those microscopic blood vessels that bring oxygen and building materials to the wound site. Researchers at Harvard Medical School found that diabetic patients experienced a 47% reduction in the speed of wound closure compared to non-diabetic individuals, even when the wounds were identical in size and depth. After age 70, your body's inflammatory response, which despite its bad reputation is actually a critical part of wound healing, becomes less efficient. A process that might have taken 5 days at 40 might take 12 days at 70, even without diabetes. Add diabetic blood vessel damage on top of that, and a small blister for a new pair of shoes can turn into an infected ulcer within weeks. Beverly was a 74-year-old grandmother from Nashville who came to see me with what she called a stubborn blister on the ball of her foot. She had been treating it at home for 6 weeks. 6 weeks. When I examined her, the wound had reached the tissue layer beneath the skin. Her blood sugar had been running high for years undetected. We caught it in time, but it was a very close call. What Beverly told me has never left me. She said she had called her doctor's office 3 times during those 6 weeks. Each time she was told to keep doing what she was doing. She was not ignored out of malice. She was ignored because no one connected what seemed like a minor foot issue to something systemic. That is the gap this channel exists to close. Please, any wound on your foot that has not shown clear improvement within 2 weeks deserves medical attention. Do not wait. Now, before we get to the top 3 signs which are genuinely the most surprising and the most critical, I want to take just a moment here. If this video is getting you information you wish you'd had sooner, please hit that like button right now. And if you haven't subscribed yet, please do. I post videos specifically for people in their 60s, 70s, and 80s who deserve straight answers from a real medical professional. Hit subscribe and ring that bell so you never miss one. Now, let's get to the top 3. Number 3 is something I have never seen covered on any health channel, and I want you to think carefully about whether this applies to you. The sign is a change in the shape or angle of your big toe, or the development of a bunion that seems to be progressing faster than expected. Now, bunions are common. I'm not saying every bunion means diabetes, but here's what the research shows. A study published in Diabetes Care found that joint inflammation and connective tissue glycation, which means sugar molecules literally binding to and stiffening your tendons and ligaments, like caramel hardening around a structure, can accelerate foot deformity in ways that mimic and worsen bunion formation. The tendons around the big toe joint lose their flexibility, and the joint alignment shifts. For aging bodies specifically, after age 65, the tendons already have less water content and less elasticity. Diabetic glycation of connective tissue can reduce tendon flexibility by an additional 20 to 30%, dramatically speeding up structural changes in the foot. If you or a loved one has noticed that a bunion or toe deformity seems to be worsening faster than expected, that acceleration itself is worth discussing with a doctor in the context of blood sugar screening. Number 2. And this is the one I promised you at the beginning that would surprise you. Is a change in your foot odor. Specifically, an odor that is sweet, fruity, or almost chemical in nature. I know this sounds unusual, but stay with me. When the body cannot properly use glucose for energy, which is exactly what happens in uncontrolled diabetes, it begins breaking down fat for fuel instead. This process produces compounds called ketones, and ketones are released through your breath, your urine, and yes, through your sweat, including the sweat on your feet. The resulting odor has been described as sweet, fruity, or similar to nail polish remover. Research from the University of Edinburgh used specialized sensors to detect these volatile organic compounds in foot sweat as a potential early screening tool for diabetes, finding a statistically significant correlation between elevated ketone compounds in foot perspiration and undiagnosed diabetic states. This is cutting-edge science, and it's fascinating. For older adults who already experience foot odor due to decreased circulation and skin changes, a shift to a distinctly sweet or fruity smell is something worth noting. If people around you have commented on an unusual sweetness to your foot odor, or you've noticed it yourself, please mention it to your doctor specifically. This is not common knowledge even among medical professionals, but the research is there, and I've linked it below. And now number 1, the most critical, the most dangerous, and the most commonly ignored warning sign in your feet that could mean diabetes. It is the complete absence of pain when pain should absolutely be present. This is called loss of protective sensation, and it is the reason diabetes is the leading cause of non-traumatic lower limb amputations in the United States, responsible for over 100 amputations every single year. When diabetic nerve damage progresses to a certain point, you stop feeling pain in your feet. You can step on a nail, develop a deep ulcer, sustain a significant burn from a heating pad, and feel absolutely nothing. The catastrophic danger here is obvious. Pain is your body's alarm system. When that alarm goes offline, injuries that should prompt immediate action go unnoticed for days, weeks, even months until infection has set in at a deep level. The American Pediatric Medical Association reports that by the time many diabetic patients present with severe foot infections, the damage has progressed because they literally could not feel it happening. Here's a simple at-home test. Take the end of a pencil eraser, not the sharp end, and gently press it against 10 different spots on the bottom of your foot. You should feel pressure at every single point. If there are areas where the sensation seems dulled, absent, or where your foot doesn't seem to wake up to the touch the way your hand does, that is a red flag that warrants urgent medical evaluation. Walter, a 79-year-old retired engineer from Columbus, Ohio, came to me after his wife noticed him walking differently. He had stepped on a small piece of broken glass 2 weeks prior and hadn't felt a thing. By the time we saw him, there was an infection between 2 of his toes. We treated it successfully, but his wife told me afterward, "I had no idea silence could be so dangerous." That sentence has stayed with me. Walter had spent 40 years as an engineer. He was a man who noticed things, who paid attention to detail, who trusted the systems around him. But no system had ever told him to check his own feet. No one had ever handed him this information. And so the silence at his nerves went unrecognized, unquestioned, until his wife's sharp eyes caught what the medical system had never flagged. The absence of pain is the loudest warning sign your feet can give you. Here is what I need you to understand, and I want to say this directly to you wherever you are watching from right now. Whether you are 62 or 81, whether you've been ignoring your feet for years or just started paying attention today, it is not too late. The body has a remarkable capacity to respond when we give it the right information and the right care. I have watched patients in their late 70s reverse prediabetes completely. I have seen people who were told they would lose a foot walk out of my office on both feet because they caught the signs in time. Your independence, your ability to walk your grandchildren to the park, to travel, to stand in your own kitchen and cook a meal, all of it is connected to the health of those 2 remarkable structures at the bottom of your body. Your feet carry you through your entire life. They deserve your attention, and now you have the knowledge to give it to them. Check your feet every single morning. Know the 9 signs. And if something doesn't seem right, don't wait. You are your own best advocate. If this video helped you today, please give it a like. It truly helps this channel reach other seniors who need this information. Subscribe if you haven't already, and leave me a comment below. Which of these 9 signs surprised you the most? And again, tell me your age. I read every one of your comments and I am grateful for each of you. Take care of those feet, and I will see you in the next one.